When we're thinking about a vision, a lot of medical facilities do have on-site small surgical wings. So they'll dedicate one of their treatment rooms to a minor operating procedure room. We took it a step further. This building is 8,000 square feet, so if you can look up, you can see all the corridors their way around. It just had ample space. So I said, you know what, man, I might as well maximize the potential of this building. So the only time anyone needs to go upstairs, unless you're administration, be a patient. Why? Because I said, man, let's build our very own Class C operating room. But not just an operating room, we're gonna put a surgical suite. So we come on upstairs. So we get on the elevator. All right, so this elevator opens two ways. I have the two in the front is off because they have other structures. So full service elevator. Good. So brings us right to the second floor. So the second floor will encompass my office. Right now there are two bathrooms here which will be demolished and they will be reworked to my office. So all this right here will be essentially my office wing. Why did I pick this side to be my office wing? Because there's a very, very important thing that all physicians need. That's the exit door. The exit door is when you got to make a run, you got to get out, and you don't want to cross in front of your patients because, hey, that may uprout them and say, hey, man, where's the doc going? So it leads right out. I have my very own exit strategy. Leads right back out and outside the building back to the parking lot for my office. And now never really have to interact. So this is where you'll be the administrative wing. I was nice enough because my staff has been so great to me. I inherited two young ladies in my practice that really bought into the vision. So I had to reward them. So we're going to have a nice staff lounge, which also allows them to keep an eye on what's going on in the practice. So they have ample fireproof windows, and they can always look what's going on. Always keeping a watchful eye of the practice. So right here will be the new staff lounge. We'll put a refrigerator. We'll put TVs up. We'll put a nice stove and all that good stuff up here. All right, so all these walls again will be knocked out. If you see this structure, this little area here is actually going to be the changing room for the operating suite. So if you can kind of zoom in on what we have going on here. And see my doctor's office is there. And then I have the staff lounge, and then the lockers and change room, staff toilet and showers and such. So, let's go back. All right, so like I said, a lot of our doctor offices, they have the minor surgical room, but I said, I want to take it a step further. I can service patients even further. The hospital has done a great deal. Healthcare is changing, and I just want to make sure when patients come see me, they may not necessarily want to go to the hospital. A lot of people have fear of hospitals. A lot of patients in this area, have family members may have perished at certain hospitals and they don't feel comfortable. I want to make them feel comfortable and say, hey, you don't have to worry about that because I'm going to take you from the patient rooms up to your very own surgical Class C facility. So this area here would be the 400 square foot operating room that we will soon construct. You can see all these walls are pretty much drywall. They'll be knocked out, 400 square feet. General anesthesia capable, so it will be encompassed. Not only podiatry, I can do orthopedics, I can do vascular, I can do any procedure that you can think of. All right. So in this wing, all of this still, you can see in the next room. This will also be a part of the operating room. Also has the just for storage, for different sutures and supplies that we need. This wing right here will be the pre-operative and post-operative phase. So when the patient gets off the elevator, we're walking right down here. It'll be curtained off for the pre-operative and post-op phase. And then we'll roll them right into the operating room, like so. Boom, boom. Keeping privacy at the most. Housekeeping room, we'll put the nourishment room. Patients, have to be NPO, means no food after midnight. for early morning procedures or within 8 hours. So when they wake up out of anesthesia, they have the nourishment room, clean storage where I'll keep all my towels and, you know, scrubs and things like that. Soil working room. So once I'm done in surgery, guess what? I have to get rid of the waste. So we'll have a soiled room to with safe waste will come daily and pick up things post-operatively, and a clean assembly room. Which are components here, and then back on the back side, I have the sterile supplies and my lab as well. So, as you can see, boom, boom. Another side of the elevator. You come this way before, you know, surgical staff, my lab. And there we have it, man. This is the building as a whole. We hope we do some good here. It's been a long road. We're finally here, man, so I'm excited. So I'm looking about 8 to 12 weeks, we'll have a soft opening. All right.